Welcome to the podcast on difficult to diagnose melanomas. There are 4 melanomas that are currently proved problematic to diagnose, and they include nodular, desmoplastic, and amelanotic melanoma, and melanomas that have a symmetric morphology. We recently investigated the morphologic features of thin nodular melanomas. It is well known that nodular melanoma often lacks the clinical ABCD features of melanoma. However, dermoscopically, one can often find clues to help correctly identify these lesions. The key features of pure nodular melanomas is that they lack network, streaks, and regression structures. From their inception, nodular melanomas have a vertical growth phase, and they lack any evidence of horizontal growth. Due to the fact that nodular melanomas lacks a horizontal growth phase accounts for why they do not manifest streaks. Nodular melanomas also do not have reedy ridge involvement beyond 2 to 3 ridges, and this accounts for why they do not display a network. Also, nodular melanomas grow rapidly and do not regress, thus they do not display regression structures. For the pigmented variants of nodular melanoma, it is common to see a blue-white veil, multiple colors, crystalline structures, and atypical vessels. For the amelanotic variants, it is common to see atypical vessels and crystalline structures. The pattern manifested by nodular melanomas is a disorganized, homogeneous pattern. Following are a few examples. Here's an amelanotic nodular melanoma with non-polarized dermoscopy image B, revealing irregular linear vessels. With polarized dermoscopy, which is image C, crystalline structures are evident. Here's another amelanotic nodular melanoma with numerous serpentine vessels in a pink background. This is a pigmented nodular melanoma with irregular blotch and an irregular blue-white veil. This is a blue macule on the forearm of this man. It is an outlier lesion and thus should be evaluated further. Its clinical morphology is consistent with a blue nevus. With dermoscopy, one would expect to see a homogeneous blue color. However, dermoscopy reveals a disorganized pattern with irregular blue-white veil and brown pigment. This proved to be a nodular melanoma on biopsy. The next most difficult to diagnose melanoma is desmoplastic melanoma. Desmoplastic melanomas often appear as banal lesions or can present as a subcutaneous firm mass. The fact that desmoplastic melanomas have a banal appearance is also reflected by the fact that the differential diagnosis for desmoplastic melanoma often does not include melanoma. Potential ways to help diagnose this lesion include any lesion on chronic sun-damaged skin that is asymptomatic, growing, or appears as a scar without a history to account for the presence of a scar. In addition, it is important to palpate lesions suspected of being lentigo maligna, since desmoplastic melanoma often is associated with lentigo maligna, and in this case will present as a firm area within the lentiginous proliferation. With dermoscopy, desmoplastic melanoma may reveal irregular blood vessels. Here's a firm scar-like lesion on the chest of this elderly man. With a dermoscopy, one can see hairpin vessels and corkscrew vessels. The presence of such vessels in a scar-like lesion is suggestive of melanoma. This lesion was biopsied and was consistent with a desmoplastic melanoma of 5.6 millimeters. A few more examples. This lentiginous lesion on the forehead was palpated and revealed a firm area on the inferior pole of the lesion. With dermoscopy, one can see a circle within a circle structure that is a structure associated with lentigo maligna. In addition, just below the scale is a cluster of irregular vessels which corresponds to the firm area noted on palpation. This lesion proved to be a desmoplastic melanoma in association with lentigo maligna. Here's another lentiginous lesion on the arm of an elderly woman. The bluish area was firm on palpation. With dermoscopy, the lesion revealed tan structureless areas and focal blue-white veil, which corresponded to the firm area noted on palpation. Pathology revealed a lenticle maligna with a desmoplastic melanoma. Melanomas that appear as symmetric lesions can also be difficult to diagnose. We often associate melanoma with asymmetry. However, clinically asymmetric lesions can still be melanoma. Such symmetric melanomas will usually manifest at least one of the melanoma-specific structures seen with dermoscopy. This clinically symmetric melanoma revealed atypical network, negative network, and focal regression structures. A few more examples. Here's a symmetric lesion on the abdomen of a young lady. Dermoscopy reveals a symmetric lesions with irregular globules in a blue-white veil. This lesion was biopsied and was consistent with a melanoma. This is another symmetric lesion on the back of this gentleman. Under dermoscopy, it reveals serpentine vessels. This proved to be a 1.6 millimeter amelanotic melanoma arising in a dysplastic nevus. Another important point to remember is beware of pink lesions. Here's a symmetric pink patch on the back of this gentleman. With the dermoscopy, the lesion reveals numerous dotted and serpentine vessels. This lesion proved to be a melanoma, as can be seen in the pathology specimen. We recently did a study on amelanotic melanoma that were not of the nodular subtype. What we found is that most of these lesions appear as symmetric lesions. The reason for this is likely due to optical properties. In a pigmented superficial spreading melanoma, the pigment grows in random directions, resulting in asymmetry and irregular borders, as highlighted in this lesion. However, if the pigment was removed, then one loses the ability to appreciate the asymmetry and the irregularity of the lesion. What is seen instead is the vascular volume within the lesion. This results in a symmetric appearance of the lesion. Dermoscopically, these amelanotic melanomas appear symmetric, however, they all reveal irregular vessels, including dotted and linear irregular vessels. A full description of irregular vessels seen in melanoma can be found in this publication in the Archives of Dermatology. In brief, lesions, even if symmetric, revealing greater than one shade of pink, or revealing dotted and/or linear, irregular, or serpentine vessels, should be viewed with suspicion, and a biopsy should be considered. As can be seen from the aforementioned issues regarding amelanotic melanoma, it is not surprising that these lesions can also be difficult to diagnose. The clues to the correct diagnosis of amelanotic melanoma include the presence of irregular vessels and crystalline structures. Here is a symmetric amelanotic lesion with numerous dotted vessels. This lesion was biopsied and was consistent with an amelanotic microinvasive melanoma. Here's another lesion on the abdomen of this man. Dermoscopy reveals dotted vessels and linear vessels. This lesion was biopsied and was a microinvasive amelanotic melanoma. Here's another pink plaque on the arm of this elderly gentleman. With the dermoscopy, one can see irregular vessels highlighted by the oval and crystalline structures highlighted by the arrows. This was an amelanotic melanoma. I hope I have succeeded in highlighting some clues to help correctly detect some of the more difficult to diagnose melanomas you will encounter in your practice. Thank you for your attention.